Hello, St. East families, parents, students. My name is Kathy Sheerhoff. I'm the school nurse at St. Elizabeth and have been. This will be going on to my 8th year at St. Elizabeth. I'm excited to come back. It's going to be a little bit more challenging, but we can get through this. I know we can. We've got a lot of things we put in place. I'm going to touch base on several things, and then I want to kind of go over the SNAP portal with you a little bit. But we're going to go over a few safety things. First of all, let's just go right here. Okay. I want to talk real quick about symptoms. High risk or new cough, usually a dry cough, difficulty breathing, loss of taste or smell. These are what they consider the high risk because the new cough is usually one of the major symptoms. Difficulty in breathing, of course, you must seek medical help. And loss of taste or smell, if you cannot taste or smell anything, that would be a symptom that you need to seek and talk to your healthcare provider. Moderate risk symptoms, and these are sometimes confusing, and I know that parents ask about it. Well, what if I just have a sore throat? What if my child just has a runny nose? Do they have a sore throat and they've never had a sore throat? It's not normal form. Are they a little congested and runny? It'd be the same as if we didn't have COVID. You would want to keep your child home and monitor them to see if the symptoms resolve or get worse. If they start running a fever, any of these things, you're going to want to keep your child home with moderate risk and with the high risk, definitely high risk. Talk real quick about multi-inflammatory syndrome in children. It usually occurs days or weeks after a COVID-19 infection. And we know that children are a lot of times asymptomatic or have a very mild symptom. But parents, I want you to be aware that and we'll be watching for this too at school, any fever that won't go away, neck pain, complaint of neck pain, an unusual weakness or fatigue, a rash, abdominal pain, complaining of abdominal pain, vomiting and diarrhea. If they have red, cracked, swollen lips, red eye, swelling of the hands, please contact your healthcare provider immediately so they can get treatment started sooner. Real quick, isolation or quarantine, what is the difference? Isolation is if you're sick, quarantine if you're exposed. So if you're in isolation, you're a sick person, you're staying away from people for at least 10 days until symptoms have gone away, and that's from the start of symptoms. Quarantine means you've been exposed to somebody. You know somebody, it could be somebody in your household, it could be anybody, but they've told you that you've been exposed to them. You need to quarantine for 14 days because exposure is usually 2 days before, 2 or 3 days before, and several days after before symptoms start. So you're not sick, you don't have symptoms, but you were in contact with somebody who was sick or who had a positive COVID. It's 14 days from the time you're exposed or notified. Jackson County defines it as if you think or know you've had COVID-19 and have symptoms, you can be with others after, and this is at least 10 days, have passed since your symptoms first appeared, and at least 24 hours have gone by without fever and without any using fever-reducing medications, that's ibuprofen, Tylenol, such, and your symptoms have improved. So you must check all those boxes off to be known that you can be with others. If you do test positive for COVID-19, but you don't have symptoms, you can be with others at least 10 days have passed since you're first positive. For anyone who has been around a person with COVID-19, a positive test or symptoms, you have to remember that anyone that has symptoms, you stay away for 14 days in quarantine based on the time it takes for the illness to develop. Flu and COVID-19, this is going to be, I know people are going, what do we do when this happens? We're going to treat flu and COVID the same. You're ill, you're going home. You stay home. Don't be out if you are feeling ill. If you feel these symptoms, try not to tough it out, especially in this time of this pandemic. But it'll be a little bit, for some people, difficult. Err on the side of caution. Talk to your healthcare provider. And they're stressing that everybody get their flu shots this year. And Dias and flu clinics haven't been announced. So if anybody's ever participated in any of those, they haven't been announced. And I would not wait for them. I would go to your healthcare provider as soon as they are offering flu shots. Go to any open flu clinic, CVS and Walgreens. Here's a little comparison of symptoms. I'm not going to go through them, but you can see some of these overlap a little bit. but there are some major differences. Like cough is usually dry with COVID. Flu is usually mucousy. Yes, you can have fatigue for both of them. That loss of taste and smell is a big one. Sore throat can be in both of them, and mucus, and flu really usually improves with 7 to 10 days. So basically, just cover if you're around people and you don't have a mask on, please cover. Try to stay at least 6 feet away from everybody, and don't touch your eyes and nose. Wash your hands. It's preferable with soap and water. If you don't have it available, use an alcohol-based sanitizer. Masks are required at school, in the building, with all students and staff. And please stay home if you don't feel, even if it's a mild symptom, it's better to stay home a day or two and see if it resolves than to take a chance of exposing anybody else. And please seek medical attention if you have a cough or breathing problems or the loss of taste and smell, and follow the directions of the local health authorities and your physician. I'm not going to go through every one of these but this is really important. When wearing a mask, you want to make sure that you washed your hands before putting it on. Wash your hands after you've taken it off. You want to apply it with the ear loops, and you want to make sure that it's touching from the nose to the bottom, and don't touch the real big things. Don't touch the front of your mask. I know it's kind of, sometimes that happens, it slides. If you grab from the top or the sides and kind of adjust it, that would be better. And then use hand sanitizer following touching that mask. I want to go through some health room procedures that are a little bit different. The health room will be moving into the lounge. It was the teacher's lounge. We needed a larger area to set up isolation and to be able to keep the sick more isolated from well. The children coming in for anything well will not actually enter that area. That will be strictly for students feeling not very well or who have symptoms. And these are the little pods. We're calling them ships. Father likes to call them prayer pods. But these little tents, you may be familiar with them. These are the weather tents that a lot of times soccer, outdoor. These are what we will place a student who has multiple, and they're very sick, fever and so forth. Mild symptoms that, that need to go home. And if these are full, we have an area that's just separated by several feet between chairs. No one will have access to the area except myself. And if I'm not in the building, then it'd be a designated person. It'll probably be someone from the office. And we're all going through training on how to be in this area. And these are where your children will wait, and then they'll be escorted out to you. So if you hear them talk about the ships, the pods, the little tents, that's what they're talking about, if they should ever be in that, or just to kind of keep them safe and kind of isolated. Students with symptoms, basically what's going to happen is the teacher will inform me. I will go down to the classroom, do an assessment if necessary. If not, if I'm not able to come, then the nurse will instruct the teacher how to send to the health room. Students will always wear their face mask, and another students will not escort, and we will not have student escorts. That's why it's important that I will have to go down. And that pretty much is, we can do this, we can encourage one another, and we need to build each other up. And that's what we're trying to do. And I think everybody's working really hard on this, and I appreciate that point. Want to go back to, I want to talk a little bit about, excuse me, let me get my other screen up here. I want to share the PowerPoint for, well, let me show you this very quickly, sorry. This here screen is, can my child go to school? And I will try to have this available, and you can use this one, see it. But ask yourself these questions. Have they been in contact with anybody who's tested positive or been exposed to? And then if you go through this whole list, and if my child's well enough, do they have these symptoms? Does your child have a fever? These will kind of give you an idea. Just follow this. And I hope to have this available that parents can have it. They can print it and they can put it up on the refrigerator or wherever you want to keep it, and to help you remind yourself. It's kind of a quick way to look of everything I've just talked about. The next thing I would like to share with you is quickly, I want to go over SNAP. Excuse me, let me get this one up here. Okay, I want to go over Snap here real quick. And okay. This one here is just a little bit, I know you've seen this one, it's been in the news updates, but I have updated this as of yesterday after the news updates have gone out. But this is basically information. You can access this anytime, day or night, from your phone, from whatever. It's very important because this is the way you communicate with me. It's a fast way to communicate. It pops up when I have a message, it will pop up a window to me. I know that if you message me, but if I'm not, not in the office, I won't see it until the next day. So be aware that if it's urgent, just let somebody just send me a voicemail, however you want to communicate to me for quickness. But this is a great way to communicate with me, and this is the way I'm going to be communicating with you because one, the portal is HIPAA and FERPA compliant, and it's much more secure. If you ever get it encrypted, that's because I'm trying to really do extra protection on your child's health information and trying to keep that safe. So this is the login page. Some of you, if you've not logged on yet or logged on to a different device, this area here, enter password, may pop up as date of birth. You need to verify your child's date of birth first. Then this screen will pop up and you can enter your password right here. This is now popping up. If you haven't been on, if you were on previously before August last week, it started last week, then I really want everybody, if you need to be on and really looking at this daily. This is how we will be doing our reentry screenings, how this is a daily screening. You need to look through this. You log on, all your children will be, you can find all your children up here. But the good thing about this, you don't have to click every child, and I'm not sure if I've miscommunicated that to anybody, but you'll look through these symptoms. And you have to look, has any of my children had this? If any of my children had uncontrolled cough, have they had any vomiting, diarrhea, sudden headache, fever, anything like that, close contact, then you're going to review that, and then you're going to hit close the window. There's a down lower, it has close the window. So you're going to do that, you're going to close that window, and then there'll be a pop-up. This will pop up. This is how you report yeses and nos to those previous questions. The previous questions are based on what you just looked at. It's a yes or no. You just click yes or no. I mean, no or yes. No's first because it's green. You're good to go. Yes, stop. Don't come to school. If you have more than one child, they will appear together on this screen. You enter the yes or no for each child and their temperature in this screen. If you are using your cell phone, we kind of figured this out. If you're using your cell phone, you will need to turn it sideways. So it's horizontal, so you can see this whole screen and enter completely. If you, for some reason, get past this and you don't know what happened to it, you can click up at the megaphone and you can click up at the bell. So the megaphone will give you the announcements. You can look at the questions. The bell, you'll click on it. It'll tell you you need to do the symptom reporting check off. If you answer yes to any of the questions, or your temperature, if your child has a temperature, please keep them home and call that absence into the absent hotline for St. Elizabeth. Hey, please, one thing don't forget to do, here's a sample of how it's clicked. Yes, I mean no, no. Temperature, temperature. One thing is don't forget to submit, click the submit button. If you go on and you close out your thing, you've not recorded it. So please remember to click submit. Just really quick for those who haven't been on or those who need to go back through and review, there are some that have confirmed maybe the conditions but not the contacts, or the contacts not the conditions. Those both need to be clicked, because if you don't click on them and confirm them, you're going to keep getting emails from SNAP. And you probably, I'm going to go through again and probably find who hasn't done it and send out an email to remind you to do this. But please do this before the start of school, which would, I prefer to have it done by Tuesday, but today would be great. Here is the demographics. You'll just see this. This this you cannot change. This is an area that can't be changed. It's only changed and updated by myself. Contacts, you can go in and there's I don't have that up on my screen, but you go in to click there. Up at the top will be a strip of color, and that will say confirm, or you just click on that. If it all looks okay, it'll list all the contacts that are in there. If there aren't any and you want to add some, there is a button, you can click on it and just say add, and then add who you want to add in there. Health conditions, please verify those, because if nothing was reported, that's what's in there. If your child has some health concern, an allergy to medications, seasonal allergies, I'm even recording those now, keeping really good track of those so I know who has what. But those are where you're going to look. I enter whatever you inform me of. So please verify them, make sure they are current. Once you verify them, then that's kind of in place of the health form. Health forms are only filled out by new students, preschool and kindergarten, and any students that are new to our building, are new to our school, or if you have changes, then you need to do that. Vaccines, you can look at your child's vaccine record. And if you have any missing vaccines or anything that needs to be attention to, it will pop up and let you know that. Medications, this is for students who have medications that are dispensed at school. If they're being dispensed at school, then you'll see, I'll share that with you, and you can see when it's been dispensed and if it needs a refill. Office visits, usually only if it's pertinent. Most of the time, I'm more likely going to call you than put an office visit up here. Screenings, when the screenings are done, now this year screenings are not going to be like they have in the past. Right now, my goal is to do pre-K and kindergarten and maybe third grade, but I have to, because I'm doing it myself, I don't have the volunteers or the school of nurses, that it may be different. And then you can also look at any letters that are up there. Messages that come from me or you will be in the message area. And the forms is where you're going to find if your child has an allergy or asthma, that you have a form there that you fill out. If our child needs medication at school, there's a medication consent. The big thing is follow directions, because when you download, you'll fill it out, you'll save it with your child's name, then you will hit return. And that should come up, because sometimes they're coming up not completely filled in. And I will get back with the parents that have done that. Most of the time it's okay, but don't worry about that. This is kind of new for everybody. So that's basically, so these are the new features as far as the health check daily. You'll notify, and it'll notify, and it notifies me a yes, no, or not done. So if your child is not, if you have not filled out that daily health check, your child will not be able to exit their car. You have to pull over and you will have to fill this out. Please take their temperatures at home. It's more consistent to use the same thermometer in the same environment to get an accurate reading. You know your children, you know your thermometer. There can be differences if we're trying to use the non-contact out in the heat or in the cold, but that's why we want parents, and it's parents' responsibility, and that we're following according to Children's Mercy, the AAP, CDC. So it's the best way to do. And it'll be quicker for you to get through that carpool line. But basically, remember, all students must have a completed daily health check before coming to school. And it will pop up and it will notify me. If you haven't done it, we'll know. And if you mark yes, then we'll know. But if you mark yes, please keep your child home. All families will need to assist us by logging into the SNAP portal and doing this. And you need to know how to use it before the first day of school. It's already up and running. I recommend you go in every day from now until ever and get used to using it. And if you have any difficulties, bring it to my attention as soon as possible to see if I need to make it's something maybe I need to adjust. It's possible that I have an old email. Information does not automatically roll over from Sycamore to SNAP. I have to enter that. So that's why I really like to know if you go in and something doesn't look right, please notify me immediately. Or if you're not able to log in, I will work on getting either your password reset or find out if it's the email issue. And please, at any time, please contact me. I'm available for questions. If I can answer them, I will. If I know the answer, I will do my best. If not, I will find out for you. So I'm just hoping for a really healthy and happy and good year. It's going to be different, but We're going to get through this. Thank you.